Chronic fatigue strikes young and old, fit or not.
I've got out of really tough situations. This was probably the toughest one I've ever had to go through.
Nowadays, we are hyper-aware of the need for good hygiene. But it wasn't always a given. Back in the day, even doctors didn't get the link between bacteria and disease, and would happily finish up an autopsy, then get to work on their next patient, without washing their hands. Ew!
When it comes to human health, we've made incredible advances through the years, but there's still so much we don't know. There's one condition that continues to challenge the medical profession worldwide.
Dr. Rosamond Vallings has specialised in it for over 35 years.
Pockets of people were diagnosed with different things in different parts of the world, often following some sort of infection. And so it was labelled Tapanui flu in New Zealand. There's Icelandic disease, royal free disease, Los Angeles epidemic. And the first conference I went to, which was in about 1978, I think, all these doctors from around the world beginning to realise that what they were talking about was all the same thing. And it began to be labelled chronic fatigue syndrome, or in some countries they call it ME, myalgic encephalomyelitis.
Sports star Richie Barnett has represented New Zealand in rugby league and played professionally all over the globe. But nothing could prepare him for his chronic fatigue diagnosis.
I've been through adversity before. My face now is reconstructed. I've got 10 plates in there through an injury playing rugby league, intensive care for 7 days. And I've got out of really tough situations. This was probably the toughest one I've ever had to go through, because there's no answers to things.
We thought we were going crazy. That was the worst time before the diagnosis, not knowing what it was, and we couldn't understand why these medical professionals couldn't tell us what was wrong.
Part of the difficulty of pinpointing chronic fatigue, or ME, is that the symptoms differ widely from patient to patient.
The commonest symptoms will be a difficulty with exercise. People find that you're often highly motivated to do exercise, but if they push beyond a very minimal amount, they get a worsening of all symptoms and often feel very, very ill. They get a lot of muscle aches and pains, headaches. Many people get sore throats and glands up as signs of an immune system in overdrive. And a lot of people will say the worst symptom is brain fog, where they get this kind of cognitive difficulty. They cannot concentrate for very long.
Physically, it stripped away my essence of who I am as a character of a person. Energetic, ready to go, attack everything, positivity. Since a young kid, that's what I've always been about. Emotionally affected me because physically I was drained and fatigued. Frustration, disappointment, depression, lost my purpose, unsure.
Chronic fatigue strikes young and old, fit and not. In fact, those that push themselves very hard, whether in work, study or sport, are a particularly at-risk group. It often follows a viral infection, like flu or glandular fever, but in some cases, there also appears to be a genetic factor. In New Zealand, thousands of people suffer from chronic fatigue syndrome, but due to its complex nature, the illness is often misunderstood and regularly stigmatized.
It's really hard to explain what chronic fatigue is, and people are like, well, you're tired. So what? I'm tired all the time. Get up and deal with it. Harden up, toughen up. That was sort of the perception that people have, and I think people still have that perception today. It's very misunderstood.
In my mind, it was better off not saying anything. I've got this condition, I have to deal with it, and just forget about the perceptive views of people because it's just too much.
Despite being notoriously difficult to diagnose, there are ways to combat chronic fatigue.
Setting up a management plan is important. Medication is sometimes helpful for sleep and certainly for pain, and sometimes we use medication to help prevent some of the symptoms of what we call POTS, which is very lightheaded tendency to feel very faint easily because of a very low blood pressure. For those people, extra salt in their diet can make a really big difference. There is some evidence as to how and why B12 could help, and there will be perhaps up to about 70% of people who do benefit from B12. So there are kind of a lot of management strategies, but you have to tailor it for the individual, really.
There is hope. There's resources out there for people to tack into. The trainer that I had who was aware of it, actually, which was outstanding, he said you should do things that you really like more often. So a strategy that I had early on was going to the gym, only for 5 minutes. If that was to make me happy with the endorphins, I'd go and do it. In my head, it felt great. Just even if I walked in, did one press up or something, just walked out, and then had a coffee. That's fine.
It's difficult to diagnose and tricky to treat, but sufferers of chronic fatigue should be rest assured that there are now professionals on the case investigating this debilitating condition.
Sham treatments have been around as long as time,